my name is Rebecca, and today we're going to talk about the pros and cons of medical use in the United Kingdom. Medical heroin can either help or hinder its patients. We all know heroin to be a killer addictive drug, but what if this was not the case? What if other countries actually used heroin medically to treat its patients? I conducted some research and found that countries do in fact use heroin medically to help individuals. You may be asking yourself, why should I care about medical heroin use in the UK? Well, medical heroin was actually created by scientists to be used medically. So, if it was created medically and it works, why wouldn't we use it? I may be able to answer some of these questions for you. I will now give you some background information and history on medical heroin. Medical heroin hit the market in 1898. It was used for illnesses such as hay fever, bronchitis, and laryngitis. It can be given orally, and orally is the most common use, but it can also be injected into the veins, muscles. It can be inhaled or put into an epidural. It is used in hospitals and primary care facilities. And you are prescribed medical heroin based on the severity of your pain. Doctors must be approved for a government license in the United Kingdom to be able to prescribe medical heroin. In fact, in 2004, only 90 doctors carried this license and were able to prescribe heroin. In my slideshow, you will see a graph that shows 270,000 people in the United Kingdom were heroin users, and less than 1% of those users used medical heroin. I will now that we've discussed the history and background of medical heroin, we will discuss the pros of medical heroin. Medical heroin is used for people with severe pain, such as hip replacement, C-sections, and abdominal surgeries in children and babies. Medical heroin is also used for people who are terminally ill, such as cancer. According to Gossip, a researcher of addiction, and Keeney, a doctor, found in a study that medical heroin was used for severe and mostly continuous pain among 28% of patients in the terminal phases of cancer. Medical heroin is also used for heroin addicts. It was legal for heroin addicts to receive the medicine in 1998. It's given to the typical patient for this type of medical use are heroin addicts who have failed rehab or have failed methadone treatments. The heroin addicts are given small doses and required to visit the doctor multiple times a week for checkups. It's also been found that heroin addicts who receive medical heroin end up reducing health, social, and crime problems. A trial conducted in 2002 by Dr. Sprout found that prescription heroin helps patients who had a heroin dependency of more than 5 years improved by 40% in health and social functions. Another trial conducted where 800 patients were given prescription heroin. Most of these patients reported improved health, living conditions, and re-entry into employment. This also led to a decrease in crime. The cost to supply the heroin was about the same amount as they saved in judicial costs due to crimes heroin addicts typically commit. Now that you've learned about the pros of medical heroin, we will talk about the cons of medical heroin. Medical heroin is a long and costly process for heroin addicts. According to the National Treatment Agency, injection maintenance treatment is likely to be a long-term treatment with long-term resource implications. For people who use medical heroin for pain, it can lead them to having a heroin dependency. A study in 2012 found that patients treated with heroin reported significantly higher levels of cravings than non-heroin users, but did not differ in the pain relief. Also, on medical heroin, there's not many studies done. There's probably about 10 studies done in the United Kingdom. There's also no restrictions or protocol on the way doctors prescribe and give the heroin. Doctors don't have to report the users. They're not required to put any data on the patients or the treatments that they're receiving. This leads to a lack of data and information for research and to see if it's actually effective. So this could lead people to believe, is medical heroin actually effective? And does it work better than other pain relievers and medications? To conclude, we will discuss that medical heroin was made scientifically for medical purposes. Doctors must have a license to prescribe medical heroin. The pros include helping terminally ill patients, helping pain users relieve their pain, and getting addicts back on their feet. The cons include dependency and costly and long-term effects and process. So what are your thoughts on prescribed heroin use? Do the pros outweigh the con or vice versa?